Hello, friends and fellow at ICCEM and new colleagues joining this founding conference of ASC. I am Dohyeong Kim from Dallas, Texas, virtually sending my heartfelt congratulations to all of you. I greatly appreciate the efforts of the organizing committee for giving me the opportunity to share one of my research work on COVID-19. Since March, I have done multiple projects on COVID-19, the unprecedented public health crisis we are currently going through, but I'm particularly interested in this work on face masks because it relates to so many different aspects, not only science and medicine, but also culture, politics, economics, and interesting global comparison. Now, mask wearing is part of our daily lives, but it was not true back in spring. Back in February and March, when we had only hundreds of cases in the US, even CDC and WHO suggested the face mask is not recommended for a healthy person. But later on, they changed their recommendations, and now there is a strong consensus among the scientific community that face mask is the key to control the transmission. However, we need to overcome more difficult barriers to improve the role of masks to control the pandemic. So during the several minutes, I'll briefly talk about some data on the current status on mask wearing and share how my research addresses the concern. So even if vaccines are coming sometime soon, we must still wear a mask because of a lot of limitation of the vaccination. So there is a good match or combination of mask wearing and social distancing. And this is the guideline from a CDC. So if you wear a mask and also do some social distancing, so it will be very small and minimal risk of exposure to transmission. However, there is some dilemma on social distancing because there is always trade-off between the public health risk and the economic risk. But there is additional dilemma on mask wearing, and typically in Western countries like Americas or Europe. So compared to the very high mask coverage in East Asia, so in the United States and some European countries, their mask wearing coverage is still pretty low, mostly because of the cultural aspects on the face covering. But it is a lot better now, but there used to be some stigma or some prejudice on people who wear a mask prior to COVID-19. But it is well known that the face covering is really effective in controlling the pandemic in the initial phase. So if you look at the graph, the countries, mostly in East Asia, where masks are highly strongly advised, they were able to control the pandemic and as good as possible compared to the other countries without the mask mandates. So back in April, there's a big gap in mask coverage in the Western countries like the North America and the Western Europes. So things are getting better, and in November, the mask coverage rates in the United States and Europe is getting better as high as 70% or 75%. But according to scientists, that's not enough. So of course, there are many other factors about effectiveness of the masks as well, but mask coverage rate needs to be as high as 90 or even 95%. So if you look at the temporal patterns of the mask usage patterns in the US, and there's a big jump back in March and April from 10% to 50%, but only gradually increasing and is actually stuck at 70%. But as we all know, in South Korea and all the East Asian countries, mask coverage rate is as high as 90% and 93%. But even with this high coverage of mask wearing, but still these Asian countries now facing third wave of the pandemic. If you look at the patterns spatially, then there's also pretty strong variation across the country. So depending on where you are and what kind of culture and social system is, then the compliance with the mask covering is different. Of course, depending on the how state mandate those policies and regulations, so it's highly related to their cultural, political, and economic priority. So there are lots of papers already out there about who wear a mask and why. So most of the typical social demographic variables are a key factor to determine their preference or attitude and behavior of wearing masks. But our approach is actually based on the dilemma about risk versus risk trade-off. The mask wearing is not easy in the Western context compared to the Korean context because there are so many different sort of the trade-off. For example, the between personal freedom and public safety, health risk versus economic risk, strong governmental control versus political rights. Are, all these are really intertwined to make things a little more complex in this matter. So our approach is to really think about the how to classify people based on their perception and attitudes and also the support for the governmental mask mandates. So we actually classify all the Americans into the 4 different groups: believers, compliant disbelievers, non-compliant believers, and defiers, based on the data from YouGov Internet Panel Survey of 2,000 respondents, and survey was conducted between August and the early September. We asked 2 main questions about their face mask wearing behavior and the attitude toward the governmental mandates. And then we are able to control all other covariates related to COVID-19. So this is a result. In our 2x2 classification, about 60% belong to the group A, who support the face mask regulation as well as the wear face mask themselves. But 13% are strong opponents of the idea of the mask wearing as well as the making those as mandates. But our focus is mostly on the group B and C, who are showing some mismatch between their attitudes and the behavior. So who actually belong to group B and C? And there are very unique characteristics of these people belong to these groups. So group B, more likely a rule compliers. So they tend to confirm their characterization as a rule compliers. But group C is kind of opposites. So they're likely to be younger, politically disengaged. So our suggestion based on these findings are probably the mandates, local, state, and national level mandates, coupled with the appropriate measure of sharing the strategy could bring them into compliance. So the mask wearing rate could be as high as at least 95% to the 89% to 90%. So it's pretty comparable to the other country with a success controlling of the current pandemic. So these are all the supplementary information about our survey data. And one of the very compelling sort of region of their grouping is, of course, the political ideology. So in relation to the recent presidential election, the Trump versus Biden, this is a key determinant of determining their group membership across these 4 groups. And also we ran a multinomial login model to statistically find the determinants of each group membership. And And as expected, most of the key variables are found significance, and particularly their knowledge, the perception question about how they think about all those facts and the related information about COVID-19. So finally, our discussion based on this study, we found that there is some dichotomy situation is not really true or misleading. So some people who oppose mask regulation actually do wear masks themselves, but some who support regulation do not themselves wear masks. So we need to have a different strategy to handle a different group. So first, this die-hard group of defiers may be very difficult to put into the group of the supporters or compliers, but we must divide a very informed messaging strategy to maintain their compliance or bring them into the level of compliance. So our mandate policy needs to be very smart and informed and based on the evidences. And lastly, the key to raising compliance beyond that 77% is to understand these two groups and how we can address their concerns and situation more strategically. And that's the key to control the current pandemic by using this face mask as one of the best and low-cost strategy. That's it, and thank you, and happy mask or Zoom holidays to you all.